What's the downtime like? Um, Here we go. I think he's here. I think he's waiting to come. He's just knocking on the door. Hi.
Hello.
Dr. Emer, thank you so much for joining us. I'm going to say good evening because it's 7 p.m. here in Ireland, but of course it's good morning to you.
Good morning. Yes. Hi, guys.
Thank you so much for coming and joining me here in this little room, virtual meeting. But I'm so excited, like I was just explaining to those watching us already, your page fascinates me. I absolutely love the work you do. You're definitely a pioneer in your industry and almost artistic, I would say, with the work.
Well, I went into this just wanting to help people and get really good at my craft. I didn't know, just like, someone that plays piano or does sports, that once you start doing this, that the ones that have that artistic ability, it starts to shine. It just kind of happens. And that started happening with me early on with liposuction, and now with fillers. I feel like things are becoming very commercialized, so that people, that they're all these temptations to get procedures done are almost everywhere. And you really want to go to somebody that understands the art and the anatomy and the philosophy to give a natural look. And luckily, over time, it's developed into more of an artistry than a skill, I would say,
Yeah.
Thank you.
So you have obviously seen your industry evolve, and I'm curious to know how social media has affected your industry. Talk to me.
Well, I mean, when I moved to Los Angeles in 2013, I think we did a TikTok the other day of my move from 2013 to now. Instagram and Facebook had just started. It was more of a Snapchat thing. There wasn't a lot of social media. And very few doctors were doing what we're doing now. And people were still looking at websites. They were still doing word of mouth. But now, hey guys, I just want to say to all these people that are saying thank you so much for all the compliments. I know you guys are following this. It's fantastic. And I'm really excited to be on it. So I'm going to give you guys a lot of information. And it wasn't that big. And when I moved to Los Angeles, I said, how do you get yourself known in an industry where it's up and coming, people are really wanting to do it, but everybody around you is doing the same procedures. So how do you stand out? And to me, that was social media. And I actually chose to go from Snapchat to Instagram so that I thought Instagram and YouTube were going to be the way to be. And look at it now, 6 years later. It's really the way that everybody's finding. Instagram and YouTube are your brochures. They're your digital lookbook to people, your philosophy. People like you feel like you even know me, and we haven't even met. Patients that come to see me, they give me a big hug. They say, hey guys, because I do that all the time on Instagram, and they just know it because they've watched every video, they watch every social post, they follow the philosophy, they get to know you, and it's a way in which you get to date the person before you marry them, meaning having that procedure, and you get to really understand them, because false marketing will stand out. And a true person that truly cares, that shows really good results, that connects between the person and their audience, will really stand out as somebody that's a pioneer in that field. And that's where I think social media is going. I think it's almost going to the point now that it's going to be so instantaneous, it's going to tell you where to be looking based on what you're searching all the time very soon. Thank you guys so much for the compliments. It's really sweet. But yeah, I mean, I really, it's now the way in which I sort of have, I think, defined the industry, because when I started doing, like I said, there was only 2 other doctors. Now almost everybody is doing it because that's the way that they promote, but also they're up in the game. Every time we do a new post, I have my own marketing company. Every time we do a new video or a new type of post, every doctor around here has now done that type of video or that type of animation or that time of before and after. So we're trying to change the industry one new creative idea at a time, which is, Corona kind of took that away a little bit, but once we get back, we're going to start showing you some really innovative ways to connect to your doctor that you haven't seen before. you know?
You know, I often talk about that with regards to Instagram. It just creates the pedestal for the true genius to shine. And of
Exactly.
course, it's also building a trust between you and your patient, which is integral for the kind of work you do.
I agree. And, you know, that's why a lot of what I like to do, and my social team, I'm sure, is watching right now. I have, like I said, an in-house marketing company, is patient stories, you know, the reality of the treatment. You know, people go, you know, they'll comment on my thing like, I don't notice that much of a difference. Well, that's because we want subtle and natural. We don't want a big difference. But look how happy that person is. Why do you care if she looks dramatically overdone? If she's super happy, and when she puts her makeup on, has that little highlight that just makes her pop, that's all I care about. Or if I'm doing lipo and I had to do a tummy tuck because the person had loose skin and they have a scar, that's the reality. They're going to have a scar, but we can laser the scar. We can, you know, do other things with that scar. But look how happy that person is now when they bend forward, they don't sag anymore. They have a shape, they have a contour. So, you know, it's really funny to see the, I hate to say the haters or the people that criticize, but I always tell people the reality is what's going to drive people to see you, because you're being honest and you're really showing the truth of what these procedures do. That's why I like showing, like, after someone had a big laser treatment, their nerve blocks, they can barely speak, and blood is on their face, and my team is saying, oh my God, we don't want to show her right now. I'm like, no, that's exactly when you want to show her, because you want people to see that I didn't have to put the person to sleep. I didn't have to do strong medicines. We can do this in the office. Yeah, you look a little crazy for a few days, but look in a week, 10 days. Look how good. And then look at 2 years later. I have a Snapchat yesterday. I have a client of mine, I didn't remember, 2.5 years ago, did a very big laser procedure on, did some TCA cross for acne scars, and now is a musician. And he wrote, I've been following you for 2 years. That one treatment you did on me changed my whole life.
Yeah.
And that's what I like to show, because anyone can manipulate a before and after photo. Anyone can show Botox being injected. But do you see the person 2 weeks later when the eyebrow is like this and the other one's like this? Well, that's not a good result. It doesn't matter how they injected it.
Yeah.
We want to show the reality. I want to show people, you know, that you're looking to develop that long-term relationship with somebody, because if something does go wrong, these procedures aren't perfect, then you go back to them and you tweak it or you fix it. It's not about going online and making negative comments. It's about developing that long-term thing. How long have you been going to your hairstylist?
Yeah, I know for sure. Yeah.
Same thing, your dentist, your hairstylist. You develop that relationship. Maybe that one time the hair wasn't perfect, but you didn't just, you know, go to another person. You develop that trust. And that's what I think we're trying to do with social, more than just selling a procedure. Because if you sell a procedure, it's short-lived. You have to sell the long-term relationship and the long-term goals of that person, so that you can, as new things come out, we can really, you know, add those things in and that people feel comfortable.
And tell me, do you find yourself sometimes like in a position, maybe a conflicting position with your patients, like when they have their demands and then you have your professional opinion? Like, where do you guys meet? How much of their demands influences your ultimate decision with what you do?
You know, I'm very blunt and very honest. So actually, some of my online reviews where are negative are usually one of two things. It's either the combinations I do are too expensive, or I tell them something they don't want to hear. I am very honest. I want good results, the best results possible. If somebody needs a facelift, they need a facelift. Otherwise, they're going to sign a form that says they didn't want to do the facelift, and the other treatment I'm offering is not going to give them a result. I'm very, very honest. I will turn patients away. I will explain to them why the procedure that they do need is more complex, more time intensive, and requires more technology. And I'm very blunt, because I want people to trust. I think that's the way to be. You know, I have so many of my liposuction cases now are revision cases, because like I said, 6-7 years ago, no one was doing this high def sculpting, the body contouring. People just wanted to be smaller. Now they want definition, and that requires technology that can build scar tissue, that can burn skin. And so many patients will go to someone much less expensive with less experience and then get a burn or a scar or irregularities and then think that it's going to be really inexpensive to fix. It's actually probably much more difficult to fix and more expensive. And so, you know, people will get really upset at that, but it's the truth. I mean, I explain to them why, what the technique is, what the technology is. It's like asking somebody, commissioning them for a painting. Every one is going to be different. You're commissioning me to fix that, you know, bad result. Every one of them's different. I can't even tell you a price. Some of these cases take me 10, 12 hours to fix. You know, and it's unfortunate, but this is kind of the age we're living in now, where people see social, they see manipulated before and after results. They go to that person who probably misled them or didn't tell them everything in honesty. And then, we don't get a good result. So we have to fix it. So I think honesty is by far the most important.
Yeah.
And then, you know, really understanding what treatments are available, because I think that's the other thing is very few people, they see a treatment online and that's the only thing they think that's there, or doctors only have one laser and they offer only one thing. And that unfortunately often leads to either no result or a bad result. We happen to have 80 lasers. I'm not saying that everyone can have that, but you want to go to somebody that can offer you many different things, not just the one thing that they have.
And tell me, I know, let's say for me in the clinic, particularly when I used to do brows a lot, they could come into me with a photograph of Jennifer Lopez's brows, because that's what they wanted. I'm thinking people come into you with maybe pictures of a Kardashian bum or something like that and say, give me.
All the time. I mean, you know, in Hollywood, I'm a Midwest guy from Chicago. When I moved here, I always tell people I was thrown in as a Midwest guy in a 90210 zip code. I did not belong here. I'm very honest. I'm very sweet. I don't care about celebrity status or popularity, but I think that's why actually the celebrities came to me, because I didn't look at them any differently. And when somebody does that, I will tell them straight out whether or not it can look good, whether or not it's something we should do. And often they'll say to me, like, for example, you bring up J-Lo, they'll say, I want to look like J-Lo. She spends $30,000 a day on taking care of her body and her face. That's including her food, her skincare, her working out, everything.
Supplements.
That's $1 million in a month. The average person can't afford that, you know? So when someone says, I want to look like J-Lo, it's not the procedures that make her look like that. It's her diligence in the gym. It's her diet and exercise. It's her genetics.
Her stunning Hispanic genetics. Like, who doesn't want that?
Yeah, I mean, her mom's beautiful. So, I mean, in general, you know, when people want those treatments, I say, look, the average person gets a facial a month. The average person gets a laser or a peel every couple months. You do basic things like skincare every day. You know, and then if you have some condition like acne scars or pigmentation, you do more treatments to get there. But that's the average. We do things yearly to prevent tightening, you know, prevent sagging, that tighten the skin, maybe once or twice a year. And then anything beyond that is going to be what you can afford. And so, you know,
I have noticed in my clinic as well, girls are getting younger and younger and coming to me with facial photos. Where do you stand on that? Like, what age do you look at?
Well, you know, listen, I look at my skin. I'm almost 40. I always show people now I am using my Emer skincare, which will be coming out really soon. I'll gladly send you one of our treatment kits, and it's going to be launching in a month.
Please do.
Quite amazing. We did 2 years of research. I'm telling you, it's going to be really, really successful. And we have a whole launch of things over the next year or two. But I'm almost 40, and I do lasers and peels every 3 or 4 months. I do microneedling and facial every month.
Massive microneedling fan.
And I do skincare. But the reason I brought that up was when I was younger and had acne, I did teen facials. Okay. So I think being on skincare and doing light facials when you're younger, I think does do preventative, staying out of the sun and being really healthy in the gym and what you put inside I don't drink alcohol. So, you know, drinking a lot of water and being healthy internally. But then as you hit the 20s to 30s, hormone levels change. You need skincare to get exfoliation for collagen production. I do think starting microneedling or at-home dermal rolling, which we do on my website right now. I have a whole sort of kit of what people can do when they're younger. Microneedling, dermal rolling kit you can do at home once a week. It's very easy. It's inexpensive for somebody that's in college or has little acne scars or pigmentation.
Do you
MRI.
mind me asking
Yeah.
what depth is that roller?
Yeah, I mean, I like 0.5 for people that are at home and under. Now, you can probably go up to 0.75. In the US, we don't allow 0.75 or higher at home. I don't know what is allowed outside. I mean, obviously, you can order anything on the internet nowadays. But I wouldn't suggest going and doing bloody type facials by yourself. There's risk of infection, scarring. I've seen people with hyperpigmentation. But in general, you know, I have on emeragecosmetics.com this one company that I tried over 100 micro rollers. I haven't made the video yet, but with this one company that we really like, the actual needles are very made of really good steel, and the quality of the handle is really good. But in general, you know, I tell people those types of things like at-home peels, like the Enlightened Peel that I made with a company called Retinol. It's something you could do at home, very inexpensive, a couple times, and over the year and make your skin look really smooth. But you should be doing monthly facials with an esthetician starting really young, getting on good skincare that even just lightly exfoliates. Nowadays, people are doing growth factors and peptides for anti-aging purposes, but always a retinol and some sort of alpha hydroxy acid for exfoliation, at least starting with that, and sun protection. And then, you know, what lasers and microneedling and stuff comes in is expense. You know, in the US, one of the lightest lasers we have is Clear and Brilliant. And it's all over the world, but in the US is much more popular. It's 1 or 2 days of redness, but it works for melasma, pore reduction, fine scarring. In your 20s, if you did that every 2-3 months, I've done over 300 treatments in 5 years. Your skin, I mean, look, it just doesn't age. I can go in, I have very little pores, you know. I mean, I have very little, I mean, very fine, very minimal fine wrinkles. I'm starting to get, in your 20s and 30s, you start to get some sagging through here. So I always tell people in this area, and especially in women around here, we do a little bit of a stronger laser once or twice a year, like an erbium or a CO2 laser. But in general, you don't, even though I'm the laser guy, you don't need a ton of lasers to have really nice skin.
A question came in from Anita. I'm not familiar for this, but she wanted your opinion on a Fontana 4D laser. Apparently Kim Kardashian has it, so.
Yeah, you know, listen, so Kim has worked with almost all the doctors here in LA, and every one of the doctors here have almost every laser. Fotona does deep heating. So in general, I tell people there's a whole slew of products that are out. And remember, you don't want to go to somebody for the lasers. You want to go to somebody for their expertise and skills. So for example, you don't need Fotona to have a really nice tightening effect of your skin. There's many other treatments. And to be honest, deep microneedling radiofrequency, like Morpheus or Intensive or Fractora, or the other one is Infinity. Those do deep needling to improve scars and tighten skin. You're going to get more collagen production from that than doing like a deep ND-YAG, which is similar to what the Fotona is. And resurfacing of the skin with something like a Fraxel or a Halo or an erbium laser is going to do more textural, and you should do that when you do the tightening. Now, some people, like a lot of my celebrity clients, don't want to have a lot of redness and irritation because they can't. So they do the deep heating like the Fotona or the microneedling radiofrequency like Morpheus, and the downtime's a day or 2, minimal. So they can do that on a weekend, go right back to work, and they'll stay nice and tight. But it's not going to brighten the skin, and it's not going to improve texture. So you have to go to somebody that can hit it at every level. Fotona is going to do the deeper levels for tightening, but you're not going to get a ton of textural improvement.
Okay, brilliant. And tell me, what I think with the work you do with fillers, facial fillers, amazing. What is your favorite thing to do? What is gives the most instant results?
Well, here's what I'll tell you. You know, online, and then we go back to the social media. Most of the estheticians that show a lot of these glamorous facials, let's say, they don't do anything for you medically. They just look really cool and they hydrate the skin. But people come to me because I'm more aggressive, I'm more progressive, I want results. So in general, when we're doing those types of facials, I want things that are doing extractions, I want things that are exfoliating the skin. In the office, like I said, people should be doing some sort of microneedling or some sort of light laser every month or two. Whether it's a very light one like Clear and Brilliant, or every couple months doing a stronger one like a Halo, then you really get collagen production because there's tons of exfoliation. When you get facials, I'm more about medical grade. You know, sometimes I'll do twice a month where I'll do a spa facial once where I get massage, and you do some enzyme masks and it makes your pores clear, but it's not going to do a ton. It just helps the superficial. I call it the car wash effect. It makes this, you know, the minimal sun damage go away, but then everything comes back because the skin regenerates. After each month, you should do deeper facials where you do extractions, a stronger chemical peel, maybe some microneedling. We need stuff that's going to stimulate collagen. So in my hands, it's going to be the lasers and the really deep peels every quarter, every 2 to 3 months. In the esthetician's hands, or the lighter, or by us, it has to be nurses doing, you know, more medical grade facials. Personally, I really like salt facial because it exfoliates the skin, and that uses almost like a newer form of microdermabrasion. It's using sea salt to exfoliate. I mean, you can actually get pinpoint bleeding with it and make an erbium resurfacing without heat. It's called non-thermal resurfacing, which is great for dark skin patients because they can't do laser and they won't get hyperpigmentation then. Most often, I say the most popular in terms of facials for hydration and pushing in nutrients into the skin is dermal infusion, where you use microdermabrasion plus infusion of vitamins into the skin. It makes your skin look great. It opens the pores. It's something you could do with microneedling. And then I'd say the newest thing that a lot of my clients are doing, especially you're talking about J-Lo and all these other clients, they're doing microampule infusion or something called aqua gold, where it's a little ampule that's filled with some Botox, it's filled with filler, and it's filled with vitamins. We even have some solutions from Colombia and some other places, Spain, that tighten the skin with enzymatic complexes and antioxidants that are added. And it does light stamping on the skin, and it pushes the Botox and filler into the skin so that you get the superficial layer, but not the deep. You know, when you inject Botox, it's into muscle. And when you inject filler, it's into the skin or the subcutaneous layer. With this, it goes directly into the upper surface, about 0.3 millimeters. So it makes you glow. I mean, literally, all redness in the skin goes away for about 6 weeks. Pores are reduced. Fine wrinkles are reduced. I have people that come in, they want to do it every 2 weeks because they love how their skin looks from just doing this with no downtime. So in terms of aesthetic, you know, cosmeceutical aesthetic stuff, facials, microneedling, ampule infusion. I have a lot of YouTube videos on aqua gold and ampule infusion, salt facial if you want to be a little more aggressive. And then, you know, with me, the lasers and the deep microneedling radiofrequency treatments.
Okay, great.
I'm looking to see what other people are writing because I really want your viewers to get, you know, a lot out of it. One of the questions they're asking about skincare brand before mine. So I want to talk to you guys. I'll tell you really quickly, skincare, I truly believe, needs to be medical grade. There's a lot of products out there that are cosmeceutical. They'll make your skin glow. They look good. They go great with makeup, but they're not going to give you an anti-aging benefit. So on my website, Emerage Cosmetics, it's not just my products, because I don't even have them out yet. It's all doctor dispensed products, brands that have done research showing anti-aging results. And I'm building that up now to include every doctor dispensed brand that exists so that all over the world, anyone can get whatever doctor dispensed brand they want. So I can't really tell you what product should you use because we need to do a full assessment. If you're darker skin tone, if you have hyperpigmentation, it might be different than someone like me that's Caucasian with no issues. Or if you have scarring and redness, it might be a different thing. You have sensitivity, eczema, you know, you're very allergic type of skin, we might need to use different products. But I will tell you, there are a few companies that stand out lately, and I really think people should do research on these companies. One is called Restorsea. It's made of an enzyme that's in salmon roe, and it's very good for people that have irritated skin. It was actually designed for acne and eczema. And those that have hyperpigmentation that can't use retinol or hydroquinone, it acts as an alternative. You actually get improvement in pigmentation without all of that risk of hydroquinone and retinol irritation. Another alternative company is called Isden. They make a product called Melatonic, which basically puts your skin to sleep. And you know that more sleep, you look better. Your skin needs to go to sleep when you do, so that melatonin derivatives that are actually in this product help your skin sleep. So you actually get more collagen production and better turnover of your skin cells, healthy turnover, more regularly. And then, you know, I really like this company called RevSkin. They work with us. They're in Irvine. They came from a larger corporation and developed all medical grade. Their scientist has worked with Skin Medica, SkinCeuticals. Some of their products, the bottle may not look as beautiful as some of the others, but the product itself is medical grade and works really well. And one of their ingredients is colloidal silver, which is antibacterial. So a lot of people that have acne, irritated skin, or post-laser, any of their silver serum or moisturizer is going to make you heal like you wouldn't believe. And their retinol is super strong. I mean, look how smooth my skin is at almost 40 because I've been using their retinol, you know.
Tell me, have you ever heard of Environ Skincare, which would be the brand?
Yeah, I love Environ a lot, actually.
You know, it was voted the top medical skincare range for the 2nd year in a row this year.
Yeah, it's great. You know, a lot of people who use Environ actually like Revision Skincare as well. And there's another cosmeceutical brand that's very similar called Cosmetics. All those three kind of relate, I would say, do very well. But what I like to do is curate what people like. I give the recommendations on the type of product. So my opinion is every morning, everyone should be on some sort of exfoliating cleanser. Typically, it's a foaming one. And a alpha hydroxy acid. I like glycolic acid. Or an alpha or a beta, but I like glycolic acid, and some sort of lightening agent, like a kojic acid or an azelaic acid, and a growth factor in the morning. At nighttime, you should be on a retinol. If you have hyperpigmentation, a hydroquinone or something as an alternative, like the Restore C or the Melatonin, and then again, your growth factor again. On top of that, any moisturizer, you know, different companies like Sente, for example, have a specific technology to rehydrate hyaluronic acid. It just depends on your skin. That's where we curate it. You know, in my website, we actually do virtual consultations monthly for people that want to get new skincare regimens. So they talk to my estheticians, they send pictures, and then we resend products and we re-engage them every month. So they have a direct esthetician without having to pay to go to an esthetician. Okay. And that's on emeragecosmetics.com. A lot of people really like doing it because then new skincare that comes out, I keep adding, like what you're talking about, Environ. I've been talking to cosmetics. We're right now, I think we have 230 products, but I want to make it 1,000. I want people to have whatever pick they can get. You know, if it's an eye, even people are doing ear rejuvenation now. Lips, you know, lips are so important. You know, the look in Eastern Europe is and versus Asia versus United States is so different. But everyone wants a little bit of a plump, you know, but not always overdone. Okay. So we like lip plumpers like Lucy & Co. There's an exfoliating lip balm that we like from Restore C. You know, there's like kits that we're putting together for people that want to enhance the fillers or make it look like they didn't even have fillers. And, you know, make it look not overdone, but look better. But your lips do get skin cancer. Mm-hmm. And how I started, just so you know, was I was a skin cancer doctor. And I started removing skin cancers and people would have big scars. So I lasered the scars, and this is, you know, 13 years ago when people were not lasering scars. And they improved so much that they felt so much better about themselves because they didn't have a mark on their face. And that's how I got into doing lasers. And I realized that laser treatment for scars could really change somebody's life. Mm-hmm. But to enhance the improvement, it was skincare, sun protection, and all the at-home treatments.
Okay, brilliant. And tell me, what is the treatment that's most in demand in your clinic? Like, let's say now, if we didn't have coronavirus, of course.
You know, I mean, with me, it's different because I do really aggressive treatment. So most people are coming to me for acne scarring and liposuction. We're doing big combinations, like I said, using fillers for scars, using lasers for scars. Our go-to sort of acne scarring laser right now with less downtime but really good results is the Halo laser, because it combines both an erbium and an erbium wavelength, which exfoliates the surface, but a deeper wavelength that also builds collagen over time. The most common things are hair removal, Botox, and fillers. we do a lot of peels. I mean, most of my patients, I don't like inflammatory peels. So someone here is asking about the VI peel. Most peels are inflammatory. They burn the surface inflames and everything falls off, like you're shedding your skin. Most people develop hyperpigmentation from that or irritation. If you do exfoliation peels like Cosmelan or Enlighten, you get a similar result, actually sometimes better, but you don't cause irritation. So I know I'm one of the few dermatologists that tries not to do as many aggressive peels. But if you do more of these exfoliating peels, your end result is going to be better. Now, if you have deep wrinkles or a lot of sun damage, then you would go into something like a VI or a TCA peel or a Rev peel or a phenol peel if you're not going to do lasers. But I think that exfoliating peels, which a lot of people are doing right now at home because it's a mask that you leave on for 8 hours and then you just peel for 2 weeks, makes your skin look so good. And that's what I do every couple months. Thank you so much, you guys, for following. I'll answer a couple of these questions in a second if we have the time. But yeah, I mean, in general, the go-to things are skincare and peels, Botox, and most men are obviously wanting the Botox in that 11 line area and in their crow's area, which I probably need a little bit. But what women I'm finding are doing a lot more of is brow lifting and neck tightening. So a lot of Botox for the bands of the neck, Botox for the bunny lines right here, and Botox at the edge of the brow to give it a lift. One of the biggest things.
Can we go back to this? Can we go back to the neck? Because it's something I get asked a lot about. So you're putting Botox, where is it? Here?
Yeah, I mean, here's the thing. If you put Botox here on the jaw, you're going to slim the jaw, but you're going to make it sag more. So you have to make a choice. If you're a rounder face and you want that sculpting, it's good. But if you're thin like you, I wouldn't recommend it here because this is going to sag a little. You're going to take away that anatomy. But if you put it under here in the bands, where I go like this, these bands right here, and along the neckline, which is called the Nefertiti line, you can get some tightening there. But that's also where threads are really successful. And people are asking right now about PDOs, and I like instalift a lot, which is a different type of thread. In general, my opinion, the PDOs do very well up here, and they do a little bit down here, but not as much everywhere else. Instalift does really well through here and under here, but not as much up here. So I often do a combination of them. If you only had one type, you would do them. But often I'll look at pictures and see people do threads and see almost no results. And the PDO threads almost last 6 to 12 weeks. They will build some collagen, 6 to 12 months. They'll build some collagen, but they're not going to be dramatic. So if you want some tightening, but you want more of a dramatic result, that's where we have to do internal heating. FaceTite, which I have a lot of videos on, which goes under the skin and heats everything here. It tightens it up without having to do surgery. Or you need surgery if you're a person that is earlier and needs a neck lift. Now, if you won't do it, then we do the combination of things. Botox, some filler. We'll do externally the needling, like the Morpheus treatments to keep the skin tight. And then threads. You know, in general, people are wanting a combination. And if you only do one treatment, the result's only going to be like this. If you add other things in combination, it can make it look really good or really bad. You have to go to somebody that really knows what they're doing. You know, middle age, I would say in the between 30 and 50, typically do very well with threads and microneedling radiofrequency. So if somebody won't do an early neck lift or something, that's where I have them doing threads, lasers, microneedling, and a little bit of Botox. And they look great. You know, you wouldn't even know they had anything done. I actually posted on my Instagram the other day something called the Without a Trace lift, which is what we call it in our office. It's using a combination of things and then just looking like you didn't have anything done, but you look better. That's what you want.
Okay, yeah, absolutely. It's those little tweaks, you know.
Yeah, of course. And, you know, it's, again, going to the people that you trust. Because someone here is asking about Asian skin type, and it's really important. You know, I did my second fellowship in San Francisco, where the population there is almost all Asian skin type. And I do aggressive lasers, TCA, peels on tons of Asian skin type. I have patients fly from China all the time, maybe not right now, but all the time for treatment, because they can't trust to find somebody that knows how to treat Asian skin type. It's not necessarily the skin type again. It's the person understanding what treatments can be done in those types of skin. Or, for example, an Asian skin type where you can get a lot of hyperpigmentation, and my Hispanic skin type, you got to be aggressive with lightening. You can do lasers, but you got to pre and post treat. And I'll have, you know, comments online where people say, well, that's really expensive, or well, that's more downtime. Yeah, then you won't get the side effects. You get the results, and that's what we want. So, you know, if you're willing to follow the plan, you can go to somebody that knows what they're doing in all aspects. And somebody like you have more of a yellowish olive tone, maybe a little bit of redness in the cheeks. We're going to treat it differently than what we would treat somebody with very pale skin, but has that type Asian background, or Native American, or African American even, that just look really light. You have to be really, really careful about how you treat their skin.
Okay. You spoke briefly about the Cosmolan peel. We do that in our clinic as well, and we've had incredible life-changing effects.
Oh, yeah.
We recently started to work with their new icon treatment. Are you familiar with it?
No, I haven't used it.
It is
for me,
amazing.
In Spain is really good. Tell me about it.
Oh my God, amazing. I did it on my husband today. When I was leaving the clinic, I grabbed everything that was critical. And this was
good, and that's critical.
Oh,
peels,
absolutely.
Peels are critical.
Toilet paper and my icon treatment.
It's perfect.
But no, absolutely amazing. I highly recommend if you can get yourself a box to work with it. It's a double, you peel and then you microneedle, peel, transdermal.
So it's funny that you said that. So I know the owners of Muso Aesthetic very well. And years ago, when I started doing a lot of the Cosmolan MD and the really strong retinols from Spain, I did microneedling before we put the Cosmolan on. And that's what we do now, actually, in my clinic. I don't ever put it on, almost never alone. We do a salt facial first to about pinpoint bleeding. We microneedle the skin, and then we put the Cosmolan on. And those where we do it from home, because we do virtual consults, I send them a roller, and they do a roller to pink, and then they put the Cosmolan on at home. And it's a very similar idea. It's getting the peel to penetrate more. Some of my patients that want tightening at the same time, we do what's called a Tighten Bright. We do the Morpheus, the deep microneedles, and then we apply the Cosmolan. And I have
you get an incredible rejuvenation from it, an anti-aging.
Oh, huge. It's a lot more responsive, a lot more irritating, but my patients want more aggressive. And there's a friend of mine, Egyptian Queen Beauty, on Instagram, you should look up. She's from Australia. She does a lot of makeup and eyelashes. She's a well-known beauty expert in Australia. She comes to me every quarter to do the Tighten Bright. And we just did one, actually posted on Instagram, where we did the Fractora, Clear and Brilliant, and Cosmolan. And it was such an amazing result. We looked at a year ago what she looked like, because she's just been doing this. Almost all of her scars are gone. All of her acne is gone. All of her pigmentation's gone. She said at this age, and I think she's in her 40s, I don't want to age her, but middle age, she looks better than she ever looked in her whole life. And I tell people, if you have pigmentation and you want anti-aging, you got to do treatment forever. This is not, Cosmolan's not a one and done treatment. It's a treatment I do 4 to 6 months. If you have melasma, you might be doing it more frequently. And like I said, you know, we're being more aggressive with it to get more of a result. So we might do salt facial before, the microneedling before, a roller up to 0.75 in a depth, something like that. And people are asking me now about salt facial. I actually helped develop that device. It's one of my favorite aesthetic treatments. It's quite phenomenal. Now, the thing about salt facial is it's more aggressive. It's not like a hydrofacial or dermal infusion where you just glow. This does give an exfoliating effect. So if you want a very light salt facial, you can do it and glow. But if you want a more aggressive sort of microderm, non-thermal resurfacing where you actually remove layers of the skin, the salt facial can do it, but very minimally aggressive because it's not touching the skin, it's infusing the salts. And the salt coarse grains will help lift the upper surface to even pinpoint bleeding if you really want. And it's quite phenomenal. I know it's now in Ireland. I know it's now in Dubai. I know it in Middle East. I know it's now in Australia and in Asia. I've been asked to go lecture about it But you know, in general, you can do a similar with microdermabrasion, but I never found that what I like about the salt is it helps bring, you know, salt holds water. So if you do a salt with a silk or a salt with a dermal infusion, you get more hydration. If you do salt with a peel, it pulls the peel in more. So if you want more aggressive, we do it with the salt.
Maybe if I was to make my way to Beverly Hills, you'd train me on the salt facial.
I'll do so. We can do salt and Titan Bright, whatever you want. I think it would be phenomenal. We'll do a whole, you know, show everybody daily what you did. I think you would love it. I mean, we can do it with a peel. A lighter version, again, is the Enlightened Peel, which is just a little bit of a lighter Cosmelan. I actually created it because a lot of my patients, they love Cosmelan, but they don't want to be that aggressive all the time. With Enlightened, you can actually do it even monthly at home. And a lot of my patients will do a Cosmelan, and then every 6 weeks, they'll apply the Enlightened mask, leave it on overnight, and then go right back to their normal skincare. And they do that as a regular mask at home to get improvement, where you really can't buy that online, unfortunately, but except on our website, emeragecosmetics.com.
Okay, you need to send me that too.
Yeah, I'll send you one. I would love for you to do it and then actually, you know, talk about it so people know, because it's a really good light peel and every skin type can do it, including African American skin, which a lot of people ask about, especially dark circles and my Indian patients that have where their forehead, their eyes, around their mouth, and their neck are darker. We treat the face and neck at the same time with these lightning peels very frequently, and the at-home dermal rolling. Now, there's a company called Anti-Age. Have you ever heard of them, Anti-Age? No. So they have probably some of the best stem cell products and growth factors in the country or even the world. They're bone marrow stem cells and pretty soon to be human synthetic fat stem cells. But they have a roller, an ampule, that you can apply to the skin and hair to help it grow. So we do, in a protocol, I have patients weekly put the stem cell serum on with the roller in their hair, their eyebrows, and their face. And they look amazing, you know, and it really helps rejuvenation and is really good after peels. Everyone's asking about my skin. Let me just show you a little bit of an up close. Right now I'm doing my own skincare routine with my own line, but I'm going to do an Enlightened Peel in a week. So maybe when I do the Enlightened Peel in a week, zoom in and I'll talk to you about it on live like this if you want.
Yeah, absolutely. I'd love to.
Yeah, and I mean, people that want to get it can get it at emeragecosmetics.com, but in general, I want you to have it so you can see it. Beauty Fashion is asking questions. Hold on one second. Oh, you know, I can't give you any medical information on what retinol to use because I don't know what you're using. But we can do, you know, like I said, there's many different versions of retinols. Actually just published, I think it came out yesterday in Beauty Insider, look it on Google, of what the best retinols over the counter are. And it just came out, I think, yesterday, Beauty Insider, of best over the counters. Now, medical grade ones, I really like Rev Skin, like I said, which is on our website. But in general, I like a 1% for my face and even higher for the body. There's a product called Vivacia, which is a foam. And it's unbelievable for the body, for the elbows, for the genital areas, the buttock, knees, people where they get fine wrinkles. The foam penetrates better and it works really well. People are also asking about TNS Essential Serum or Recovery Complex, probably the most well-known and best growth factor peptide complex. My opinion is that is an investment piece. So if you're gonna get that type of product, it's a nighttime routine that you do forever. But like I said, nowadays, I do think the recovery growth factor complex is like Anti-Age, and you'll see my face cream, which has 8, actually I think it has 10 peptides and growth factors in it, is gonna kill it. You're gonna love it. So, you know, in general, and I'll send you all those too.
Well, exciting times ahead.
I know, it's wild. I mean, like I said, this industry is going to get to a point where you go anywhere and people are going to be doing Botox and filler and facials. Yeah. So my opinion, if you truly care about your long-term aging, and if you have a medical condition like melasma, like acne scars, deep wrinkles, sun damage, you really need to go to somebody that either works with your esthetician closely or is an expert in all of these things, because you're not going to get that comprehensive care from just a fly-by-night small place. I have a lot of people that have their esthetician for life, and I work with the esthetician. You know, they go to the esthetician monthly and do what we talk about. They come to me every 3 months and do the strong laser. It's all about collaboration. It's all about producing quality products that work. It's all about going to somebody that's honest and that's going to tell you what works and what doesn't, because lasers are expensive. I know a lot of people here were asking about Halo, for example. And my office is $1,500 to do with me, which is in this area the going rate for a doctor to do treatment. But if you go to a nurse or a PA, it's going to be less. I've been doing lasers for 16 years. That's why people are paying to have that done. If you have deep scars, you need to go to an expert. It's going to be more expensive, but you're less likely to have an issue. If you have Asian skin type, you're Indian, Hispanic mix, you don't want to risk hyperpigmentation. Now, can things happen? Yes. My Middle Eastern patients, their skin are very fragile. You might get a little hyperpigmentation, but we do a peel. You know, you have to be ready to, if you're going to do these treatments, if something does go wrong or a complication or side effects occur, that you just go to the doctor and we fix it. But
I
in
often
general,
say,
it's low.
I often say, buy your shoes on sale, but not your skin.
Yeah, I mean, that's true. Yeah, I mean, look, you want to, like with you, your clients developing that long-term understanding. You know their skin, you understand what's working for them, what looks good for them. You know, sometimes, you know, some products, like people are allergic, some people are allergic to vitamin C. A high percentage of people are allergic to cinnamon derivatives, and certain added chemicals and colors. So you never know what will happen. And if somebody tries a new product and they flare up, you treat it and you try a new one. It's nothing is perfect, but it's really getting that understanding. You know what I mean? And it's great. So do you know South William Clinic in Ireland?
I sure do, yeah.
Oh yeah, they're like, that was nice. They said they got the salt facial. I hope you guys are doing a really good job with it. I would love to be able to come there and teach you guys sometime. So talk to Salt Facial. Maybe I could do that. It would be fantastic. But you can do a lot in improving somebody's skin with very little. And what I mean by that is you don't need extensive lasers to look good. Facials, skincare, microneedling, regular at-home peels, you can do it. So people will come to me and say, wow, that's very expensive. Well, you don't need to do all of that stuff. We can curate to what's in your financial budget, and we can curate to what's important to you now. And that's what I think is, you know, sometimes it's just skincare to start. And then sometimes, you know, once a year, maybe you splurge on the really strong laser or the threads or the deep needling, but at least do something. I always tell people 50% of everything is a lot more than 100% of nothing.
Yeah, and you know, the sum of all these things is greater than their individual parts. You know, it's
exactly,
the
and that's
combination
why
when they all come together.
And that's why, like, when people come to see me and say I have dark circles, and I say to them, it's not just filler that's needed there. It's lasering, and like if you look at my skin, it's starting to get that early crepiness. You gotta laser that, you know, and you gotta peel that. So sometimes it's not just one treatment and go. It's a long-term plan. Maybe the fillers are once or twice a year so that it looks natural, but you're doing more lasers, you're doing more peels. It's all the combination. I even do mini threads under the eye. We're now doing a lot of PDOs around here to lift so people get tightening. In general, I would say if somebody's asking about topical steroids, I tell people avoid topical steroids at all costs to your face if not needed, and PRP, PRF do very minimal for the skin unless you're applying topical. That's the research shows quicker healing, but not so much in volume and in rejuvenation. A lot of the marketing on that is, again, those fake before and afters, or an immediate where they're not showing you the long-term result. But yeah, South William Clinic, great job. I just want to do a shout out to you because you guys are following and everything. And then, yeah, what else? Anything else? I would love to, whatever you need, tell me.
Well, thank you so much, Dr. Emer. That was like, we're almost an hour. I'm going to have to divide this into slots. Yeah, I know.
Wow. Fantastic.
And I told
Well,
my
listen,
9-year-old.
if your group loved it so much, let's do another one in a couple weeks.
Yes,
I
please.
can hone in on some of the big topics that they were interested in. Make sure to save this live so that I can put it on YouTube for you. I would love to do that.
Oh,
and you know, and listen, the one thing about me is I'm very collaborative, and I just want everybody to get a good result, near or far. You know, if you have the ability to come to me, great. And if you don't, you want to go to experts that are learning from people like me and other people in the industry that are progressive, to make sure your treatments are safe and natural. Because so much of what I see right now is just unnatural and just, frankly, just unneeded. Some of the results and the treatments just are crazy. They don't do anything. And that's not what we want. We don't want you to waste your money or time. We want to see nice, natural results. I want to know what I'm going to look like as a grandpa. You know what I mean? It should look much better and not look fake and overdone like the people who had surgeries in the 80s. We're at a time now where our type of cosmetics can be super natural, super subtle, and that's what you want. If you don't notice a big change, that's good. But if you don't notice a big change for 10 years, then 10 years down the line, you didn't even age. Yeah. And that's what I always tell people is subtlety goes very far.
Yeah, super. Dr. Emer, thank you so much for your expertise. You are a genius, and I really appreciate your time. I look forward to working much more closely with you in the future.
Me too.
Yeah, and I definitely will get out to you at some point. And thank you so much again for your time. And we will touch base again in a couple of weeks, and we will go from there.
Let me really quickly tell, just in case, if anybody wants to contact us, it's Jason Emer MD, you guys know. And our website for cosmetics, which I really think is going to build big time, and I'm going to talk to you about later. I'm going to send you a bunch of things. emeragecosmetics.com, because I really think what it can do is, for example, I can give them advice that then they can have treatments done by you. And that's the information, is being able to get information from anywhere virtually, which is what we do. And long term, I'm going to have so many different estheticians involved. I'm really excited about it. Love to everybody in Ireland. Oh my God, I'm getting so many of these green hearts. I love it. New York, and everybody following you. Chicago, New York, Ireland. I got to call out everybody here. It's great. But yeah, I really appreciate it. And I'm super excited to be involved. So in the next couple of weeks, let's do another.
Yes, please. Thank you so much. I take it as a huge compliment that you would like to work with me. Thank you so much, Dr. Emer. You have a lovely evening. Stay safe and stay well.
Thank you.
Take care. Bye-bye.